Hi guys, welcome back. I'm so excited to show you the next instalment of Jodi's aromatherapy massage. So last week you saw the back, neck and shoulders, and this week you're going to see the back of the legs, the feet and the front of the legs. This is a beautiful treatment and you're going to see the lovely aromatherapy oils with the aromatherapy massage, and stick to the end to see how Jodi feels after her legs have been massaged. Okay, see you soon. So, having revealed one leg, I now apply the aromatherapy and carrier oil very lightly to the back of the leg, and then slow down as I start the actual massage. You'll see there that I encompassed Jodi's right arm with the towel. That's to reassure that it won't fall off the couch if she wanted to allow her arm to lie further away from her body. And now giving a soft massage to the underside of the foot while she's turned over. Normally, I would actually treat the feet while she's lying on her back, but just while she's lying on her front is quite an easy, accessible way to reach the underside of the foot, using my knuckles on the pad and the heel and the in-between soft area in reflexology terms where the organs are contained in order to help digestively, respiratory. Now starting the leg massage, introducing my hands and giving the leg a gentle tug in order to lengthen. What this does is it stops a bunching up on the hip while she's lying on her front, so that the hip and abdomen can lie more aligned on the couch. And now working both of my thumbs together, one behind the other in a cross pattern, up the back of the calf. There are two larger muscles here called the soleus and gastrocnemius, and between them they have the same point at the foot, but they actually separate further up. So what I do with my thumbs is try and find a gap between them about there, halfway up the calf, in order to clear toxins from the calf. Having worked on the Achilles, the back of the heel, I now raise the lower leg in order to get gravity to help me allow circulation of the lymph and blood back up to the knee. The knee contains a lymph node, which is actually the furthest point to the extremity. We don't have lymph nodes down by our ankle or foot. Now this is called 3-finger stroking, and you'll see they're quite flat fingers, so I'm tuning into very soft lymph which lies very close to the surface of the skin, and it's a very gentle stroking, then using 2 hands to gently tug on the underside of the sit bone, and that just confirms to the lymph in order to scoop away any toxins that I'm scooping up with the massage. So it's like a communication, really. That's the main reason for aromatherapy massage, which is to encourage the effect of the essential oils into the skin and into the body, but also to encourage movement of lymph. And now, working on the back of the left leg, I do exactly the same actions as I was doing on the right. So you'll see brief repetition here as I'm just showing you short sections in order not to repeat the full back of the leg for you. Again, this is working on the Achilles, overlapping with 2 thumbs. That can be quite a tense area, so I'm always mindful to be sensitive and caring. Again, working up that gap between the gastrocnemius and the soleus muscles. I don't apply pressure until about halfway up, about there. Just shifting it, encouraging it in the correct direction. And then the 3-finger stroking, nice flat hands, working always upwards towards the heart. And then once I've reached the top of the thigh, I'm just finding that sit bone at the bottom of the pelvis to just give it a little communication that all is well and to get on with its job of clearing lymph. A little contact with the back, which just tells Jodi that I've finished that part of the massage. Allow her to turn over sensitively, covered up. Always correct use of towels, giving the client reassurance that they're covered up. And I always have contact with the edge of the towel firmly into the body so that the client knows exactly where the edge of the towel lies without having to open their eyes and look. And now continuing with the front of the body. So doing the first leg here. Again, introduction of the essential oil to the skin, that beautiful grapefruit, seaweed extract, and rose essential oils. So now, having introduced the oil, I'm now focusing on the massage. This is a lovely strengthening and clearing technique where my thumbs at first are just feeling their way as to what I find. This is each side of the tibia and fibula, the shin bones. Quite often people have different effects each side. Some may be smooth if they're young bones and haven't had any breakages. Some might feel a little rougher with knobbles, as if there may have been injury or illness to that area. So I'm always sensitive to bring relief and clear any tension from around the shin. This is a beautiful technique, overlapping thumbs each side of the knee, on that muscle each side, because the lymph node sits behind the knee. So I'm always encouraging the correct direction, away from the joint towards the node. Now relieving tension around the bone itself. This is the patella that sits on the top of the knee. And you can see there, I encouraged a little movement left to right, and then over the top of the flat bone of the patella. This feels really nice to receive. And now working on the thigh. So this is overlapping hands on the adductor muscle. Now the adductor, of course, is one of the quadriceps muscles. We have 4 layers of muscle in the front of the thigh. The adductor on the inside, which helps us to bring our leg inwards. This overlapping action follows the movement that the lymph takes, but also the muscle. So I'm working in the same direction of the muscle in order to relieve tension and spasm. Now on the outside of the leg, I'm moving much more firmly here for an aromatherapy massage, encouraging lymph back up into the groin area called the inguinal lymph, up into the pelvis. Now some knuckling on the outside. As this muscle is a very strong muscle and quite often can feel tense and needs relief with a good massage and essential oils. Having covered the leg, I'm now working on mobility for the ankle and foot. Always supporting underneath the joint while I'm creating flexibility with the other hand. Working on the top of the foot, on the metatarsal bones, and now sitting down in order to see exactly what I'm working with the underside of the foot. The foot pad in reflexology terms contains the lungs. Now working on the lung right there and into the soft tissue, into the shoulders there, creating movement in a clockwise fashion on the solar plexus and down over the digestive, and then round the shoulder point, down the outside of the foot over the joints, over the heel, and back up the spine on the inside edge of the foot to the neck, round into the head, so that's the glands and the brain, over the eye and respiratory centres, the sinuses, and down into the outside of the foot again. You see the foot does bend and rotate as I'm working on it. This encourages to clear tension. Our feet don't get enough relief and attention from us, so it's really nice to really focus on them occasionally. It's very relaxing to have your foot massaged, whether it's in a foot massage or reflexology. And again, focusing on the solar plexus, just tuning in and helping with the energy levels after Jodi's busy day at the clinic. And continuing with some mobility. So first of all into the big toe, working on all of the joints. So that's the base of the big toe, which would be the neck, and then each of the joints working into the metatarsals of each toe individually. And the toes don't just have one joint, they have possibly two, depending on the length of the toe. You can see here I'm working not only on the base, but also halfway up where there is a second joint. All of these joints are working for us all the time with our balance and movement. finishing off with a beautiful flicking movement to encourage energy to dissipate that may have stored up in the feet, as it does store up in all of our extremities. A reassuring, overlapping upward massage up the ankle, and finishing by covering up, reassuring and connecting. Having revealed the right leg, I'm now going to copy similar moves that I created on the left side, and I'll be showing you these moves a little more briefly as they are repetitions from the other side. So having introduced those beautiful essential oils, I'm now working strongly up the front of the shin, feeling constantly as I go. So I'm always looking for any issues, congestion and tension. This feels nice to receive up each side of those shin bones, this time working with fingers instead of thumbs. Around the ankle, and now the knee, overlapping that beautiful muscle relieving feeling, getting rid of any tension around that strong muscle on the inside to the back of the knee, and now into the knee joint itself, around the patella, underneath it, to the sides, up into the muscle underneath. There are plenty of ligaments, tendons, obviously the bursas as well. A lot of action, and of course the lymph node that sits at the back of the knee. All of these areas need to be stimulated and relieved. Working in overlapping hands, firmly and sensitively in the same direction as the lymph and the muscle. On the inside of the thigh, over the top of the thigh, which is a nice strong set of muscles here. Slowing down to connect with the speed of the lymph, connecting with the whole leg again, and then back up into the thigh and out on that outer side again where the abductor muscle sits. And the reason I bring the knee up slightly is to encourage the leg not to sit in a lock position. Working on the ankle again. Rotations, always supporting underneath. Not just supporting, but also feeling all the time, especially when I'm rotating with one hand, to check to see if there's any clicks and crunches within the joint while I'm rotating with the other hand. Working each side of those metatarsal bones up the edges of the foot, and now into each toe individually. Again, working each joint, so that was the lower and then the middle of those knuckles within the toes, the second and third, fourth toes, nice circles, and that lovely end joint there, relieving any tension. And then the little toe, massaging, rotating in both directions. And then working on those flick technique to bring out the tension, always connecting but relieving at the same time. And getting down to the level of the foot, always using thumbs. My thumbs are a way of finding out what tension there is as well as treating. It's a dual approach. Relieving tension within the lungs, solar plexus, digestion, and upwards. Spreading the upper ball to stretch it out. Our feet work so hard for us, and Jodi does spend long hours standing on her feet, so it's so nice to have this done. Finally connecting with the solar plexus point and covering up, ready to ask Jodi how she feels. So Jodi, just checking in with you. How are you feeling after your legs massage?
Very, very lovely. Thank you.
Yeah, all okay?
Yeah.
You still awake?
Yeah, just about.
Just about.
Yeah.
On and off.
On and off.
That's all
Drifting
right.
off.
Okay. So I'm going to be massaging your tummy and arms and shoulders now.
Okay.
All right. Okay.
Yeah.